Hello and welcome to IntimateLens. This is Dr. Katz. Today we will discuss 6 very common reasons for bleeding during intercourse. Let's take a look at that. Before we begin, just a disclaimer. This information is for educational purposes only, and it is not a substitute for medical care. We encourage you to speak to your healthcare provider about any bleeding during or after intercourse. That said, bleeding during or after intercourse is very common, and many women struggle with it. And of course, it causes great concern and great worry that something is wrong or something got damaged, which is why there is a good need for medical evaluation. But let's run through some very typical reasons that may be the prime cause for it. Some of them you can fix on your own, and others, of course, need medical intervention. So here are the 6 reasons in no particular order. Reason number 1, you would bleed or spot during intercourse because of vaginal dryness. When the vagina is dry, the thrusting of the penis will chafe the vaginal walls and will cause some bleeding or spotting. And you would be dry because either you are not lubricated enough, maybe a natural lubrication or added lubrication. You could be dry because you're in menopause when the vagina is operating under reduced estrogen, which makes it less elastic and less moist. Or there are different medications, including allergy medications and antibiotics and antifungals and some other medications. If you're plain dehydrated, you have not drank enough, and your hands are dry, your mouth is dry, your vagina is most likely dry. If you immersed yourself in water, such as ocean, or whirlpool, or jacuzzi, or a bathtub even, it cleans up your vagina, but it also dries it up. Another reason for dryness is a very long intercourse, of course, with your permission. But intercourse where the penis stays there and stays there and stays there, and your natural lubrication or the added lubrication got absorbed, and now it's time to either finish or add more lubrication if it's okay with you to continue. Another reason is Sjogren disease, which is a condition of extreme dryness in the body, to define it loosely. And of course, anxiety, that always is a dryer. Your mouth is dry when you're anxious, so is the vagina. So reason number 1 is vaginal dryness, and you can take measures to fix if you suspect any of those reasons. Reason number 2 is cervical contusion, that is the buffeting or the tapping of the penis against the cervix during intercourse, which the vagina is built for. But some women have a more sensitive cervix, either more sensitive all the time or sensitive at certain times, say after childbirth or after surgery or at certain times of the month or at certain positions. Also with that tapping against the cervix concept is a penis that's superly enthusiastic, and sometimes they get in there with a lot of excitement, and that could be just too much physical tapping. So you know what to do in those cases. Reason number 3 for bleeding during intercourse, which is so common and so benign, is if intercourse happens with bleeding on the last day of the period or the day after you're done with your period, when the tapping of the penis on the cervix, against the uterus, will shake out the leftover blood, which normally would have been absorbed by the uterus. So sometimes that would also cause some bleeding, but there would be more darker blood or almost brownish, like end of the period blood. Reason number 4 would be vaginal infections, which definitely need medical care. Reason number 5 would be the tearing at the bottom of the vaginal opening, or the 6 o'clock as women refer to that area. And that could be because of different reasons. Either you are a little drier, as we mentioned above, and there is some tissue tearing, or it's an episiotomy that hasn't stretched out yet, or it's a leftover hymenal tissue, or you have lichen sclerosis. There are different reasons for why the area will tear a wee bit at the bottom of the vaginal opening. Definitely have it evaluated to be reassured that all is well. And reason number 6 would be cancer. Whereas cancer intervention contributes also to vaginal dryness, as to be included in reason number 1, such as if you receive chemo or hormone suppression medication. But cancer also could be radiation that causes structural restrictions in the vagina, at times, not always, but it's typical. And also some dryness, or you have some sort of burnt skin there that even if it heals, it's thinner and more susceptible to microfissures and spotting or even bleeding. Could be surgical repair that bleeds upon penetration. So there are different mechanical reasons in the vagina when cancer is involved that will cause bleeding during intercourse. Of course, you would like to speak with your healthcare team to make sure that you're good to go to have penetration, but then you have to take some measures according to what the reason of the bleeding. So to summarize, if you bleed with intercourse, assess the situation against this quick punch list and take this punch list to your doctor. That's okay too. Just be sure that you are getting proper advice, proper evaluation, and proper management so you can move on with intercourse without worrying. Hopefully that explains it. Let us know if you have any questions. Share, like, subscribe, and we'll see you next time.